Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will meet Dr. Richard Thompson, who is a new physician at Novant Health OBGYN. Then we'll speak with Stephanie McLeod, Chief Nursing Officer of Novant Health Brunswick Medical Center. And we'll talk to her about the new patient education channel and newborn channel at the hospital. Finally, we'll talk with Randy Thompson and John Bridges to learn more about an upcoming Foundation golf tournament. Stay tuned to learn about valuable health topics with HealthWatch. Our first guest today is Dr. Richard Thompson, who recently joined Novant Health OBGYN. Well, welcome to the show, Dr. Thompson. It's such a pleasure to have you here.
How are you doing today?
I'm doing well. Thanks for asking. Now, let's get started, and I understand you're fairly new to Novant Health.
Yes.
How long have you been with Novant Health?
Started at Novant Health on July 14th.
July 14th. Well, you are fairly new then.
Yeah, very new.
Well, let's talk a little bit about your education and your background.
Okay. I went to medical school at Edward Via Virginia College of Osteopathic Medicine, which is in Blacksburg, Virginia. Mm-hmm. From there, I went to residency training in OBGYN at New Hanover Regional Medical Center, Wilmington, North Carolina. Mm-hmm.
And so prior to joining Novant Health, you were doing your residency?
Mm-hmm. Yeah, I'm just out of residency. I completed residency on June 20th of this past year.
Great. Well, we're certainly happy to have you here. Are you originally from this area?
No, I'm originally from a very small town, Chatham, Virginia, which is just over the North Carolina line, kind of the central part of the state. Mm-hmm.
Well, Dr. Thompson, we've had the opportunity to meet a couple of your partners here on HealthWatch. And for our viewers who might need a reminder, tell us who those partners are.
We have three great physicians, and then we also have a nurse practitioner. Our physicians' names are Tracy McCarthy, Lee Toller, and then Lee Hsu. Mm-hmm. And then the nurse practitioner works with us is Sarah Brown, who's also very, very great. Very wonderful.
She is. We've had her on the show, and she is great.
Mm-hmm. Yeah, definitely.
She did a great job on the show, but I know that the patients absolutely love her.
They can't hear enough great things, can't say enough great things about her.
Yeah. Let's talk a little bit about the locations. Are they all in all of the locations, or?
No, well, currently the providers have different office hours at different locations. Okay. Our three locations, of course, are Leland, Sunset Beach, and Bolivia.
Right.
And depending on the day of the week, we have different providers in different locations.
Well, for instance, if I wanted to have an appointment with you, I would call the office and ask for that appointment, and then are you at just one location, or do you travel also?
Currently, just at one location.
And that would be?
That's Bolivia.
In the Bolivia office.
But we'll start traveling to the Sunset Beach office very soon, within the next month. So.
Well, let's talk a little bit about the services and the procedures that you offer there at Novant Health OBGYN.
Okay, well, we offer a full spectrum of OB care to women of reproductive age, let's say, and then we also offer GYN care to women of all ages, from younger ages all the way up through menopause. We do in-office hysteroscopy, as well as in-office endometrial ablations, and in-office tubal sterilization.
Really? I didn't know that.
Yeah. And then also, part of my training comes from New Hanover Regional Medical Center is in robotics. So that's something that is offered as well.
And is that the Da Vinci?
The Da Vinci robotic system, which aids us in laparoscopic surgery, helping us to have a better better ability to do, what would be considered more difficult cases on regular laparoscopic.
Right. So that was part of your training at
Yes.
New Hanover.
Yep.
That's great.
Yep.
That's great. Well, are there any special procedures that you're very much interested in?
Probably the robotics would be what would be most interesting to me, and robotic surgery and the different facets of that. And then also doing, as I said before, the inpatient stuff, or excuse me, in-office hysteroscopies, things of that nature, because that really offers, both of those are, minimally invasive procedures and offer patients the ability to come in and have have things done that they then can go home in a quicker timeline.
Sure, sure. That's great. And it's probably a cost savings, too, for the patient.
Definitely, yeah.
Because it doesn't require hospitalization. So.
Correct, yeah. The insurance companies are, at this point in time, more willing to pay for things that are done on an outpatient basis.
Yeah, and that's certainly helpful in these days.
Yeah, definitely. Definitely.
Now, I know that you are a doctor of osteopathy, so let's talk about that a little bit, what that means to be a DO or a doctor of osteopathy. Okay,
well, the basic principles that guide the osteopathic profession are that we kind of consider the whole person. The other thing is that we have, we look to different techniques to help the body kind of, what they say, heal itself as well. But in real clinical practice, I guess it's just having the mindset that you try to do the most minimal things that you can to help the patient and help the patient be healthy, stay healthy, and maintain health. So.
And I think that's a great philosophy. I like that philosophy myself because I am a whole person.
Yeah, no, definitely. And the thing that's good about it is you can take those principles and start with the most minimal, basic kind of things, and move up from there. And we still have the training to do more invasive and specialized things if needed, if we get to that point. So,
absolutely. Yeah. Well, are you accepting new patients?
Oh, yeah, definitely. Definitely.
Well, that's great. And if our viewers would like to schedule an appointment, what would be the best way to do that?
Well, you can, of course, we have a website you can visit to find our contact information, but probably the easiest way is just give us a call. It's 721-4050.
721-4050.
Yeah, that would be the number.
Well, it's been a pleasure having you here today. Is there anything that you would like to let our viewers know before we close?
Just that you will receive the best, OBGYN care that can be provided through Novant Health OBGYN. We have wonderful providers. So.
Well, that's great to hear. It was a real pleasure having you here. It's a pleasure to meet you, and I hope you enjoy your time here at Novant Health. And I look forward to hearing from you later.
Thank you very much.
Thank you. Our second guest today is Stephanie McLeod, Chief Nursing Officer at Novant Health Brunswick Medical Center. Well, welcome back to the show, Stephanie. I know you've been here before, and it's a pleasure to have you back today. And I understand we're going to talk about something new and exciting at Novant Health Brunswick. But before we do that, let's reintroduce you and tell us what you do at Novant Health.
Okay. Thanks, June, for having me again. I'm Stephanie McLeod, and I'm the Senior Director of Patient Care Services and the Chief Nursing Officer at Novant Health Brunswick. And I'm here today to talk about the new patient education channel.
Well, good, good. Tell me a little bit about your role. I know you said you're the Chief Nursing Officer and you're Senior Director of
Patient Care Services.
And what does that mean, Stephanie?
That actually means I'm over a lot of services that are involved in taking care of patients, such as all of nursing, and then also pharmacy services, which deliver medications to our patients.
Correct.
Physical therapy, which gives services, respiratory therapy, and surgical services. So anywhere you see a nurse, generally I would be over that department.
I see.
And including a few others.
You are a busy lady.
Yes, I am busy, but I enjoy it.
I'm sure. How long have you been at Novant Health Brunswick Medical Center?
This is going on my 6th year.
Wow.
Yeah. Time flies,
Time
doesn't
flies.
it? I know.
Seems like you just came.
I know. It does.
Well, we're here today to talk about the new patient education channel and the newborn channel that were recently implemented at Novant Health Brunswick Medical Center. So tell me, what is the purpose of this new patient care channel?
It is an additional resource, educational resource for our patients and their families. It is going to be in every patient room, and it's on the television. It's channels 74 and 75. And whenever a patient turns on the television in their room, it automatically comes up on the patient education channel. So we have a variety of topics. The patient education channel is going to be more for our regular floors in the hospital, and then we also have a newborn education channel. So we're very, very excited about this. It's been proven that, well, most people love to watch television.
Sure they do.
And you can capture their attention.
Absolutely.
And
we love when they watch HealthWatch.
We certainly do. So this is just another way that they can learn about the many topics surrounding either their disease process or their condition that they were admitted to the hospital for. And so we're very excited. And it also gives the patient a voice and choice in their own care. So, you know, they can choose what they want to see on the television, and it makes it easy for them as well.
Well, that's real interesting. So it's sort of part of their care. It's sort of part of their treatment plan.
Yes, it's an integral part of their care. There are several topics on there, as I mentioned before. Let me give you an example of some.
Sure.
Diabetes, heart failure. Let's see, what are some others? On the newborn channel.
Let's talk about that newborn channel. I'm real interested in that. What does the newborn channel, what's the purpose of that?
The purpose of the newborn channel is to educate the mother and be an additional resource for her, both in the hospital after the birth of the baby and also when she goes home. And one good thing about this is that the patient with a code can access through their computer system at home the newborn channel as well. So even if they've watched some of the topics like how to care for your baby's umbilical cord.
Really?
Oh yeah. You know, how to bathe your baby. Some things to look for with the new baby.
Like before you call the doctor?
Right, yeah, absolutely, absolutely.
How about breastfeeding?
Breastfeeding as well, yes. Although with breastfeeding, we also give information while the mother is at the hospital.
Sure.
And they also have the opportunity to call back to the hospital to get additional help if they need it. But that is a topic that is covered there as well.
So really this is an additional source of information or education for the patients and the families.
Absolutely.
Correct?
Absolutely. To learn about their actual disease process or either their diagnosis that they were admitted to the hospital. And it has been proven that the more you know about your own problem, you'll have better patient outcomes. It also can help the patient to have fewer admissions and readmissions for the same problem. So it talks about being compliant with your medications and also some of the symptoms to look for in the disease process. And so it's going to be a very big help to our patients and their families, but not only them, for the physicians,
nurses. I was going to ask you about that.
And the staff.
How will the physicians or nurses utilize the patient channel or the newborn channel?
The physicians have, this was approved by our physician staff,
Right.
and they have looked at the different diagnosis and disease processes and topics that the channels offer. So they're familiar with that, as
Okay.
well as the nurses. And the rest of the staff, not only nurses, but respiratory therapists, physical therapists.
So all the departments are real familiar with this.
Anybody can offer, the patient education to a patient or their family.
So if I were a patient and my physician wanted me to watch a particular segment, he would let the nurses know that that's what I need to do, or let somebody know that I would need to watch this, and then that's how that would happen?
Absolutely. The physician may write an order even for
Okay.
the nurse to say, please have the patient watch the diagnosis of diabetes. If it was a newly diagnosed diabetic, he may ask the nurse to make sure that the patient watches that particular topic. Or he may just verbally tell the nurse, I think it would be good for the patient to watch so-and-so. So many ways. And then the nurse or the staff can, as they are talking with the patient, and maybe pick up on deficits in their education, suggest that they watch a specific topic that may help them.
Let's talk about how the patients and the families might access these channels. Now, from the hospital, you said it's channel
74 and 75.
and it will automatically come up when the patient first turns
It does.
the TV on. Now, will that channel be, can you access it from the waiting areas too?
Yes, you can, June. I'm glad you brought that up, because it is going to be in each patient room and also the waiting areas in the hospital. And then we hope to extend this out to physicians' offices too. So if a patient there would like to watch a specific topic, especially in the OBGYN areas, or the surgical patients as well, they can watch it before they actually have their procedures or before they come to the hospital.
Now, I heard that it's also available at home.
Yes, it is.
And how might that work?
We give the patients a code before they actually go home. And if they do use their computer, they can go on the website, which is thepatientchannelnow.com or the newbornchannelnow.com. And then they just plug in their code, which is 41299. And that's the same code for each channel.
For both the patient education channel as well as the newborn.
Yes.
It's the same code and or the same login.
Yes.
And
And it walks you through that
Oh, it
once you
does.
get to the
Okay.
channel site. Yes. It'll ask you for the code.
well, I think that's a great a bonus, because once you get home, you're thinking, now, what did they say I need to do?
Absolutely.
And what-
You're given so much information, and this is just another way that we can reinforce what we have told the patient and their family, so that when they go home and they're in a calmer setting, they're not as nervous. They can call up any topic they want to watch, and then if they should have questions, they could always call back to their doctor's office, or a clarifying question, they could certainly call back up to the floor that they were on.
they could probably call their nursing station. And
Absolutely. We'd be
And,
glad to answer any questions.
I think that's a real important piece. It would help you with understanding your diagnosis, understanding what you're supposed to do at home, or
Right.
understand your medications. You get home and you've gotten so much information, and it's hard. So I think that's going to be great for
I do
our
too.
viewers. And
We're
for our
very
patients.
excited. We've been actually working on this for a
Quite a
couple
while.
of years now. When we first moved in, we didn't have the hookup for cable. So now that we do, we have, gone ahead and full steam ahead.
Great. Well, this has been great. It's such a wonderful resource for our patients, and I'm so happy that that's now available. And I'm especially happy that you were able to come and talk to us about this today. So
I am too. Thank you for having me, June.
you're welcome, and I look forward to your next visit, because you always have something so exciting to tell me.
Thank you.
You're welcome.
I'll come back.
Okay, great.
Okay.
Our final guests today are John Bridges and Randy Thompson with the Novant Health Foundation at Brunswick Medical Center. Welcome to the show, guys.
Thank you for having us.
Well, it's a pleasure to have you. And first, I think we'll start learning a little bit about your roles at the Novant Health Foundation at Brunswick Medical Center and a little bit about the golf tournament. So, Randy, you want to give us a shot at this?
Sure. Our roles at the hospital on the foundation, we have a number of volunteers, community volunteers that take part in being foundation members, and we try very hard to encourage and enhance anything that deals with community wellness.
Sure.
Trying to get outside the walls of the hospital, where the members of the foundation are kind of like the liaison between the hospital and the community.
Sure, sure. So today we're here to talk about the Novant Health Foundation Brunswick Medical Center and one of its upcoming events, correct? It's a big golf tournament, am I right?
That is correct. Yeah.
Let's talk a little bit. I know you said you serve as a liaison between the hospital foundation and the community, and but you help raise funds, is that correct, and you support the mission of the hospital? We
do. We help raise funds. We've got a number of different fundraising efforts underway. We assist in funding and working with the hospital through the children's and women's outreach efforts, looking at childhood obesity. We work very hard to try to do additional education for those expectant parents that may be involved in smoking.
Yeah, I knew that you targeted the smoking. That's a big thing.
Try to work on that area, and then we recently we're trying to increase the awareness for expectant mothers for breastfeeding, the advantages of breastfeeding, and so we're really concentrating on those areas there currently.
I understand that you're also concentrating on a breast health fund to provide mammograms to all women, but especially to women who have been unable to have one, whether it be to finances.
That is correct. Trying to, again, reach outside the walls and reach out to the community in need. And being able to provide mammograms for women who are unable to afford it is a great outreach effort. We also participate in doing some comfort bags for women. Oh yeah,
I know about those.
For women who have been diagnosed with breast cancer. So I mean, there's a lot of different efforts underway.
Sounds like a busy foundation.
I think so.
Well, that sounds neat. And now I know we're going to raise funds to help make all that happen. And I understand that there's a big golf tournament coming up. So, John, can you tell me a little bit about that?
Sure. It's Friday, September 19th. And it's our third annual golf tournament at Lockwood Folly Golf Club. And it's a shotgun start at 9 a.m.
Shotgun at 9 a.m. I don't know what that means, but it sounds like fun. So, John, how does that work? Do people sign up individually or as a team?
There's different ways that you can help out with the golf tournament, different sponsorship levels and donations you can do. But you can also sign up as an individual or as a team and enter the golf tournament that way.
And how about sponsorships?
There's different prizes that you can donate, and prizes are depending on what flight you're in. There's different things given out for all the winners. But that's one way that you can sponsor the golf tournament, is to donate prizes, whatever you might want to do, or enter as individual golfers.
Can we sponsor a hole or something like that, Randy? Can people call in?
There are hole sponsors. Again, trying to, if you're interested in sponsoring, we can certainly make a sponsorship.
Do I get my name on a hole?
Absolutely.
We'll say June Baker sponsored this hole?
That is correct. That is correct.
I'll have to do that. Okay. What does captain's choice mean? I'm not a golfer, guys.
Well, and that's probably a good thing for those, and for those of us that aren't that good at golfing, captain's choice certainly helps us out a lot.
Yes.
Okay.
Yes, it's selecting your shot. So the team gets an opportunity to select their shot.
So you take the best of the four?
Sure.
Because there's 4 on a team.
That is correct.
And everybody hits a ball, and the best one wins, right?
The best
Okay.
one, that's the one
right.
we're going to play.
I would need to play with some really good people. I am horrible. So, John, you talked a little bit about the prizes. So there's a first, second, and third prizes?
Right, there's going to be different flights and a first, second, and third place prize in each flight, depending on your skill level. There's also different prizes that you can win for different activities that we're doing. There's a longest drive, a hole-in-one, a putting competition, things like that.
Putting competition.
More up your speed.
I think I'm volunteering for that one.
There
I think
you
I'm
go.
working that
there
one.
you go.
So what other things would a golfer might need to know about that day? How about activities and food and all that kind of stuff?
You know, it'll start at 7:30 with continental breakfast.
Oh, good.
Run right up till 9 o'clock.
Okay.
During that time, you'll have an opportunity to hit some range balls or practice your putting.
Okay.
Then we'll certainly have the shotgun start, and then following the completion of the tournament, then we'll have a buffet lunch, and we're known across the state for
I was going to say, I
our
heard
lunch.
that food last year was awesome.
For the past couple of years, the baby back ribs and the chicken have just been, that's what keeps bringing people back to want to play.
So everybody's going to come back for the food, probably.
They'll come back for the food.
But
So
it's also a good time. I know
it's a
that I
great
heard great
time.
things about
It's a great time.
last year's. So, well, if people are interested in playing in the tournament or they're interested in sponsoring, who do they contact, John?
Victoria Humphrey.
Okay, Victoria Humphrey. And I know her phone number is 910-721-1473. Is that correct?
Yep.
And so they can just call Victoria and get all that information. I think there's also some information on the website. I know I have gone to that. I believe it's novanthealth.org/Brunswick event.
That is
correct,
correct.
Randy?
That is correct.
And then if I went to that website, what would I...
You would see the information, more detailed information that we've talked about today that outlines how to make contact with Victoria, and you can...
I don't think you can make do a sponsorship online, or
not
you can't
online,
buy tickets,
but it will provide you with the information to make contact with Victoria, and she'll be able to help you out. Whether you're wanting to do a sponsorship or you're actually wanting to sponsor a team, or if you're an individual.
What if I was just an individual and I wanted to play, but I didn't have a team? How's that work? Would I still be able to play golf?
I believe so, yes. You would just pay the entry fee, and they would join you up with a team of similar folks, just like yourself.
Bad, right? Really bad players, right? If they're similar to me, John, they're bad.
The past couple of years, that's exactly how I've participated in
Really?
in the tournament. I've been an individual that, and that it's a new way of, in a great way of meeting some great individuals that are looking to help out and sponsor events for the hospital as well. So for me, it's been I've had a great time meeting someone new and playing golf, and I've been very fortunate that they could play a whole lot better than I could. Yeah.
Well, it's been a pleasure having you guys here. It sounds like a fun day, and it's for a very good cause.
Absolutely.
And it'll go toward those things that you mentioned about providing services for folks in the community. So again, John and Randy, thanks for coming, and I look forward to seeing you on September 19th, 9 a.m. shotgun start, correct?
That's correct.
Great. Thanks for coming, guys.
Thank you so much, Randy.
Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. Please visit novanthealth.org for more information on Novant Health Brunswick Medical Center, local physicians, and general health information. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.